When teeth are crowded, there are some options for most people in terms of how to align them. One option would be extracting teeth. We don't want to do this if we don't have to. For some people, it is easier if we are able to use what's called interproximal reduction. We also call it slenderizing, which is just taking a tiny bit of enamel off between teeth, either in the top, the bottom, or both, to get the teeth to line up and fit together. Another reason we may tell you you need slenderizing is if you have really far forward teeth. You can take teeth out to bring teeth back, but that's a little bit more invasive. For a lot of people, it would be a possibility to just do a little bit of slenderizing, to take teeth that are almost bucked out looking and bring them to a nice normal angulation. When we look at teeth, we want a little bit of overbite from the front here and a little bit of that angulation. So we want to get it that way. So it helps to line teeth up. It also can help to bring teeth back slightly. The way we do this is we use this little tiny sandpaper strip. So it's almost like a nail file where you can reshape your nails, and then you obviously could do too much on your nails. So we are very, very careful to be very conservative with what we do with your teeth. I would never do anything on your teeth that I would not done on my own. I have had slenderizing on my own teeth, and there are definitely limits to what can be done, and we would never do more than the allowable amount. When you look at teeth, you can see that there are three different parts of the teeth. There's the hard outer enamel, the soft inner dentin layer, and then the nerve of the tooth, the pulp. When you go to take off some of the enamel on the sides of the teeth, there is plenty of enamel there between the outside of the tooth and between the soft inner dentin. We're able to take off for a front tooth about 0.5 to 0.7 millimeters. We normally at our office don't do any more than 0.3 or 0.4, again, to be conservative. And in the back teeth, you can take off almost up to 1 millimeter, which I know sounds like a very small amount, but in teeth, that's actually a good amount. So we do a little bit more in the back. We may be able to do 0.4 to 0.5 in our office. We don't want to do any more than 50% of the thickness of the enamel. The studies have shown that this does not cause gum disease. It doesn't cause cavities. It does not cause any damage to the teeth as long as it is done conservatively. This is going to help create space for teeth to fit together. It's going to help alignment of the teeth so there's room to straighten the teeth without extraction. The other thing it can do is when somebody has teeth that are more shaped like a triangle, especially front teeth, sometimes it looks like there's a little piece of pepper between those front teeth. And it's really not. It's just where the gums, if you think about a 12-year-old, they have big, thick gum tissue. If you think about adults, we lose a little bit of that gum tissue over time. So sometimes you can go in between the teeth and take off just a little bit on the side, and you're able to bring that connector point up a little bit. So then where that gum tissue is minimized, and you're able to reduce the look of those little pepper spots, the black triangles. Overall, the slenderizing is minimally invasive. It is safe to do. You do not have to be numb for it. We do it here in the office, and it doesn't cause any damage to your teeth. And it's something that can be used to make your teeth fit more ideally and give you that beautiful smile you've been looking for.